Clara's condition originally actually unfolded over time. We knew some things before she was born, that there was some issue with her heart, but we didn't realize quite the severity of it until after she was born.
When she was born, she was whisked right away into the neonatal area, and they had to open her nasal passages.
So she faced many physical challenges, which were addressed one by one, one after another, over a year and a half in hospital when she was first born. Her autism diagnosis, of course, came a couple of years later.
I started noticing things like she would be staring at the lights. She wouldn't respond to her name being called. She was like in another world. You're at a loss as to what the best thing to do is, and you know you want to reach your child and help your child as fast as possible. And through some more research, we came across Jonathan Alderson's website. The first day we met Jonathan, when he came and he met Clara, and Clara came and sat down next to him, what I noticed most was that he really had a critical eye. He was able to observe her in a way that I hadn't experienced before.
In designing the program, one of the first goals was to try and create some rapport, a social connection with Clara. And she had some very strong, repetitious, ritualized behaviors, what we call stereotypes. For example, she would take CD covers and flip them up and down over and over for 20, 30 minutes at a time, and not look at people, and not listen to people, and not play or interact. She was in her own world. So I taught the therapists a technique called imitating or joining, where we would do exactly what she did across from her. So the therapist would have a CD cover and Clara would have a CD cover, and we would join in that activity with her. And it established eye contact, and we had more attention span from her, and she started to pay attention to us. And it was in that moment that we were able to begin to teach her.
Once Jonathan came in and he spent 2 days with our team of people that we had been training to work with Clara, Clara just zoomed. I mean, it was an overnight change. It was awesome, and I just felt within my heart and my soul that this was the right thing for us.
Once we had Clara's attention, she was listening, she was looking, she was willing to follow instructions. We began to do a lot more work at the table, and we put together a very intensive curriculum that covered spelling, reading, writing, math, lots of cognitive activity. But we had to keep a balance as well with the physical skills training.
In the room, we would do like balance beam exercises, somersaults, spelling and writing and speech therapy and math.
When she started, she had very low muscle tone. She didn't make any eye contact. She had no speech. Really, we had no idea what was going on in there. And then to see her now dancing and playing the piano and singing and speaking, it's just astonishing. She's a whole nother child.
She's a whiz with computers and technical equipment now.
Can you spell cream? Good stuff!
It's hard work, but it's probably been the best 4 years of Clara's life, of our lives. And probably the people who have worked with her have been touched in a way that I don't think they even expected. She has become the star of a YouTube video in the last 2 or 3 weeks that has gone viral and around the world. And this little child whom doctors basically told us when she was born to basically give up hope and basically not even allow to live, has pretty much inspired the world with her ability and her happiness and her joy of living. And I don't think any of that would have happened if we had not met Jonathan and been part of the IMTI program.
Now try swim. Swim.